do this for a living. Look for people that have a decent amount of experience, because that's ultimately what you're trying to gain from them, their experience.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Lauren Mitschrich from Core Aesthetics Training Institute. She's a doctoral level board certified physician associate. She's been practicing within the aesthetic specialty for 10 years in San Francisco, Manhattan, and now Denver. She recently completed her doctoral degree focused on dermal filler complication management and was voted into the top 100 injectors in the US twice in the last 4 years. Additionally, she serves as a peer-to-peer trainer and consultant for several of the major pharmaceutical companies within the space. 3 years ago, Lauren teamed up with Dr. Gregory Buford, a plastic surgeon, and Keely Shields, a marketing expert, to launch an aesthetic education company called Core Aesthetic Training Institute. Today, Lauren acts as the clinical director for the company. Lauren, welcome and glad to have you here.
I'm so glad to be here. Thanks for having me.
Yeah, so let's just dive right into it. I'm just curious, how did you first get interested in aesthetics?
Oh, it's a funny story. So in PA school, a lot of traditional medicine doesn't love aesthetics as a specialty. They don't really believe it's a real field of medicine. So coming out of training, I had the same belief. So here I am, a surgical PA. I loved surgery, but was like, oh, I'm never going to get into that. Never going to be that girl. I teamed up with some plastic surgeons in California, and the idea of the job was all reconstructive surgery. I had come off of a really cool rotation at MD Anderson, post-oncology reconstruction, and was like, this is it. This is my Humpty Dumpty. That's what I want to do. And so they had sold me on the idea that this was going to be the job. Eventually, I learned that it was more cosmetic plastics. And it's still fun, don't get me wrong, but it's a lot of surgical first assisting and closures of tummy tucks, and that gets boring after a while.
Yeah.
So they had some old devices in a closet, an old CO2 laser, an old IPL. They had an RF device back then. Very different. I don't even know if any of those are around the same technology anymore. But I said, hey, can I learn how to use these and start doing some independent procedures? They said, sure, go for it. Didn't cost them anything extra. And along the same lines, I was learning injectables because that's a big part of aesthetics too. So maybe a year later, we launched a facility, I guess you could call it, PS Spa. It's still there. It's in Green Bay, California, north of San Francisco in Marin, and still doing really well. And that's really where my journey began. I remember I was dating my husband at the time, and he's like, you're not going to become one of those women, right? And I was like, no, I can do this without becoming one of those. So here I am, a decade later, still doing the same thing.
Yeah. Oh, that's fantastic. Now, when it came to the aesthetic side, so talk about how you made that transition from the aesthetics now going into the training side of it.
Sure. So 10 years ago, there was not a lot of education in the space, especially for non-physicians. So physicians could go to these big aesthetic conferences, learn from each other. Not a lot of non-physicians were invited. And so there wasn't much around. YouTube was new, Facebook was new. I'm not even sure Instagram existed yet. And so there was a lot of self-teaching. I bought all the plastic surgery textbooks, anatomy-wise, that I could buy. I was pretty close to my Allergan and Galderma reps back then to try to get as much training as I could. The truth is, a lot of it was trial and error, and that's kind of scary.
Yeah.
I wouldn't teach that now, but really what it was back then. And so it was always kind of a goal to contribute to changing that for non-physicians. There's a lot of education for physicians now. There's even aesthetic fellowships, but still for non-physicians, there's not a lot. So when I moved to Denver, the plastic surgeon, Dr. Greg Buford, that I work with, he was also doing private training. So both of us were sort of doing this private training thing. There was an idea like, hey, let's formalize this. Let's make this a process. Let's make this a protocol. How do we teach successful injectors? What's necessary? And so it started as, let's do one round. Let's do one lecture series. Believe it or not, the first one sold out. And I was like, 12 students. That's the most we could hold in the conference room.
Yeah.
And it's grown from there. We've launched advanced courses, anatomy courses, a fellowship program. I think that's probably one of the most valuable things that has come out of it, a fellowship program. And then we've taken it even another step further into the business side, because medical professionals are not taught how to be business people.
Yeah, I definitely see that a lot.
Yeah. So that's really where it began. And the truth is, it's still a baby company. We've only been in business 3 years, but it's exponentially growing and it's really fun to be part of it.
Sounds like it. Now, you mentioned that you really started this up for people that were non-physicians. So who would you say is really the ideal person who really can take advantage of your class? Like what kind of situation then? Maybe not necessarily their medical credentials, but even like their personal situations. Like who's the best person for your course or your training?
I can tell you this. So our target market, our clientele are a lot of the same. We train a lot of nurses and nurse practitioners right now who are burnt out on floor medicine, burnt out on hospital medicine. They want some balance back in their life. Aesthetics has a little bit of this, I don't even know, Instagram persona that goes with it. And not all of it's true, but the idea of the flexibility, the owning your life and happier, healthier clients, that's all true. So right now it's a lot of nurses and nurse practitioners. Surprisingly, we've probably done, 20% dentists as well. We even had like a dental residency program come through once. And then I would say the other 50% is a mix of physicians and PAs. And a lot of it's the same. I want to add, for physicians, I want to add the aesthetics element to my practice, because cash-based medicine changes a physician's practice for the better, usually. And PAs, it's a lot like nurses. It's, hey, I'm really burnt out being an orthopedic PA, working, rounding at 4, rounding again at 7 p.m. with no balance and call. It's, I need a different lifestyle. I need a lifestyle change. And I think the advantage to our training program is you don't have to have any experience. Our goal is to take you from, I've worked in another field of medicine, to I can function in aesthetics independently, somewhat.
Okay.
And that's unique because in every other specialty, it's like, well, I did a residency, I did a fellowship, I did a rotation in PA school or NP school. And aesthetics, you can still do that, but it doesn't exist as much. And so we don't have a ton of requirements for previous experience within aesthetics. We do like people that have previous experience in medicine.
Yeah.
So for the, I'm fresh out of nurse training, PA training, whatever training, it's not quite as advantageous because you don't have quite that understanding of bedside manner yet, dealing with people in a real healthcare setting. But the nice thing is we have curriculum for all of those professionals.
Okay, got it. So it sounds like if you had to break it up in maybe 2 different sections, it's people that already have an existing practice that they want to bring the cash pay services into, and the ones that are working, let's say, a job, and they're just burnt out from it. Now they want to have their own thing, they have control of their own life, and just need the training on how to do it. Does that sound correct?
Totally.
Okay, perfect. Now, when it comes to the training, like the exact training that you're providing, I just want to kind of focus on your core. And I know you talked about a lot of service. I actually want to get into the entrepreneurship one a little bit later on.
Sure.
Your core training, what exactly is provided within that training?
Yeah. So let me start with what CORE actually stands for. Concise, objective, real-world education. The idea there is concise. There's a lot of courses out there that are really, really long. And the downside to that is it's really expensive and you get really overwhelmed fast. So our job is to teach you what you need to know in a reasonable amount of time. Objective, we are brand agnostic. We are pharmaceutical company agnostic. In our clinic, we use all the brands, all the products, because we think that's how we practice medicine, right? When you go to your cardiologist and they recommend a blood pressure medication, they're not owned by a pharmaceutical company who offers one blood pressure medication. You're choosing the best product for that patient. So product agnostic, real world, all of us that train for core aesthetics training actually practice. And so you're learning from people that do this full time for a living. And I think that's really important. There's a lot of, I don't want to call them side hustle training companies, but essentially side hustle training companies. It's like, I do this 1 day a week and I train 4 days a week, and you lose a little bit of the credibility in that. And so from an overview, that's what it is. Now into the details, we have options. Our basic training is just, let's learn the anatomy that's relevant to essentially neuromodulators like Botox and dermal fillers like Juvederm or Restylane. Mm-hmm. And so let's start with the foundation. Let's start with the history, the pharmacokinetics, pharmacodynamics, the physiology, and then let's talk about the individual products, why one acts differently than another, and then how to use them. Mm-hmm. And then finally, the last step of this is consultation and delivery of treatment. A lot of healthcare professionals are taught prescriptive medicine. You see this symptom, you perform this treatment, they get better. Mm-hmm. The downside to that is they don't always train you to think. Mm-hmm. There's unique fields of medicine like infectious disease, right? It's major problem solving, but that doesn't exist in all of bedside medicine. Especially in nurses, it's like, this is the procedure, this is how we perform it, this is when we do it. Aesthetics there's a lot of critical thinking and creativity behind it. So the last step is how to think as an aesthetic provider, because a lot of us weren't trained to think outside the box. Medicine is a box. Yeah. And so that's kind of the last piece. It's how to take all of this science and put it into practice. That's the basics of the foundation of, what we teach. And then everything builds on that.
Mm-hmm. Okay, got it. Now, you brought this up, and I wanted to kind of dive a little bit deeper into this point, is that, and you said it very well, as far as medicine, people think it's a step-by-step, you follow this protocol and that's all you do. But you talked about the word creativity. And would you mind talking a little bit more about how you bring creativity into your approach, and especially in how you're teaching your students? Like, because it's not just, like you mentioned, just one blah, 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 blah. It's 1, 2, 3, 4, 5. You follow these steps. You have to think a little bit more about it. Like, you have to feel and critical thinking and, I have this particular situation. I should do things a little bit differently. So really, what is your approach to training that creativity?
Yeah, that's a great question. I think really the key is it's multimodality. Mm-hmm. In any diagnosis, let's go with diabetes. A lot of things can be used to mitigate the symptoms. Lifestyle change, diet change, oral medications, injected medications. And there is a lot of prescriptive steps within medicine. Aesthetics doesn't quite have those prescriptive steps, but all of the tools are still there. So a patient comes in complaining of, let's just say, lines and folds. There's a lot of things that can be used to manage those lines and folds. The problem with a lot of aesthetics practice is when all you have is a hammer, everything looks like a nail. So if all you know how to do is Botox, everybody needs Botox. Yeah. But aesthetics is so much more than that. We have energy-based devices, lasers. We have topical chemical treatments like chemical peels. We have skincare. We have microchanneling or microneedling or collagen induction therapy. There's so many things that can be used to address a single symptom. And so I think the important thing is teaching people to see the symptom as multifaceted. Aging is not in one plane. Aging is not one problem. It's not just sunspots, right? Yeah. There's layers to that house, and all you see on the outside might be sunspots, but all of those layers need to be addressed. And the order or the steps to do so is where the creativity comes in. If you as a practitioner love microneedling, I love microneedling. It's probably one of the cheapest treatments that any patient can undergo, and it builds a ton of long-term value. And so one of my personal strategies is building microneedling into these long-term, lifelong strategies. And so teaching that creativity is saying, hey, this is what Botox can do. Botox addresses muscles and only muscles. If the problem is just a muscle, Botox is the answer. But the problem might not be just the muscle. And so that critical thinking element, or thinking outside of just a single, just the nail, is unique to aesthetics.
Got it. Great answer. Now, your classes, are they online or are they in person, or do you have both options?
So right now, most of them are in person. The push for 2024 is a lot of virtual content. So we filmed a lot of our courses over the last year, like the cadaver course. The cadaver courses are really expensive and really hard to find, usually locally, for a lot of people. And so we filmed it, and we're in the process of making it virtual so that you as a practitioner can still attend a cadaver course. It's, in my opinion, one of the most valuable things you can do as an injector. Because because it takes the understanding like from a page in a textbook to, wow, I'm looking at it in real life.
Yeah.
Like the layers, they stack like that. And so 2024, a lot more virtual content that you'll see come forward. But as of now, it's a lot of pre-course materials and then an in-person course.
Got it. Okay. Now, you touched on this a little bit before, but I want to dive a little bit deeper into really what makes your training program different from other training programs out there. You mentioned some people just do it part-time, so you don't really get that real focus on it. But I mean, this is something that I see a lot of people that want to get into the training side of it. So what would you say is really the biggest differentiating factors of why your training program is different or better than the other ones?
I think you nailed it. It's the why. Training is relatively lucrative if you can build a business. And so what we're seeing in the industry is a lot of injectors with little experience, maybe 1 year, 2 years, they're starting to launch training like classes. I've learned how to do Botox. Now I can teach you how to do Botox. The problem with that is there's a lack of experience, right? You probably haven't had that many complications in 18 months of injecting. And to really teach complication management, you have to have been through it a few times. So I think there's a lot of lack of experience between Dr. Buford and I. I think we have 35 years of aesthetic experience. He has more than I do, but we have a lot of experience. He's been around since these products were launched, which is really cool. He was part of the Botox launch, part of the Voluma launch. And so he's seen the transition in the training process, in the use, in the, when we figured out about vascular occlusion and then how to manage it. And so I think experience, and then I think the why, like I said earlier, we got into this training business because we have a passion for education. As I told you my story, I wasn't trained, and it then became like a personal passion to build something that I wish was there 10 years ago. For him, he likes to say legacy. Because he's been in this for 25 years, he wants to leave some sort of fingerprint on the industry, and he wants to be part of changing the future. And so our why is a different kind of passion. This isn't a side hustle. This isn't a money-making business. We spend hundreds of hours doing this because we enjoy it. I love the curriculum development element of it. As you know, I got a doctorate. I'm super and education focused. And so the reason I got that doctorate is because it gave me 4 years of access to academic libraries, and I dug heavy into the science of aesthetics. I read 2,000 and something publications and used that to make our content because I'm so passionate about education and bringing aesthetics back to medicine. Like I said, the legacy, leaving a fingerprint on the industry, our why is different than most training companies' whys.
Got it. Now, you mentioned this as one of your differentiating factors, but I want to dive a little bit deeper into like each of the three people within this business, yourself, Dr. Buford, and Keely. Could you talk a little bit more about like what each of you kind of brings to this training program to really make it so successful and so impactful?
Yeah. So I want to start with Keely because I think I've talked a lot about Dr. Buford and myself. So Keely, she has an MBA, and it was primarily focused on marketing. What she brings to our company is the entire tech side and the entire operational element. I didn't get an MBA, so bear with me. But what she brings to it is like, hey, this is how we build a really efficient business. These are the platforms we should use. A funny story. I don't know if you know what Monday is. I'm terrible with Monday. But Keely's like, we're going to use this platform so that we can all manage these tasks at the same time. That is Keely's like brain into like, let's make this business super functional. But what I love is she's not an aesthetic provider. She essentially helps us build a business that's not healthcare focused because Dr. Buford and I were never trained in business. He got I think an executive MBA, which helps a lot too. But I think Keely brings that like unique operational element. And then of course she does all of our branding and marketing. So our social media, our website, like how to engage our students and continue to engage them. Dr. Buford brings a lot of experience and a lot of relationships. because he's been around for a while, he's been involved in the launches. He's been a master trainer for Allergan. He's been, a consultant for I don't even know how many product launches. Mm-hmm. And those relationships make us really unique because we have access to the people that started these companies, the people that are, the MSLs or the medical science liaisons behind these pharmaceutical companies, and that makes our content more credible. Me, because I'm the mid-level of the group, I am my own target client. So I know what I would have wanted to learn. I know what I needed to learn to be more successful and not run into the complications that I inevitably did in my career. And so these three unique perspectives make the trio way stronger. It's not just one injector running a training company. Yeah. We're two injectors and a business mind. And I think that brings a unique fullness to the company.
Got it. Now, I want to go talk a little bit more into this one training program. You have the Aesthetic of Entrepreneurship program, which I think is amazing because I see this as a huge problem out there in the industry, is that medical professionals went to school to learn medicine, not to learn business. And so when they open up their own business, a lot of them they don't know where to start. Yeah, it's just like, hey, I have this business, I'm paying rent for this space. Now what do I do? So I think this is just a hugely critical component that is missing. But please talk a little bit more about this new training program of how you're teaching medical professionals to run their own business.
So this vision started with a course we have called Ready, Set, Go. Ready, Set, Go is one day of all the pharmaceutical basics, Botox, filler, anatomy. And the second day started from a book Dr. Buford wrote called Beauty in the Business. It grew to the basics of running a business, basic concepts, like how to maintain a clientele. And then it grew to, let's do a social media workshop. And then it grew to, let's do a talk on aesthetic compensation. Why are injectors compensated so differently? Then it grew to, this is what an aesthetic contract looks like. This is what you need to do to get into aesthetics, get a job in aesthetics, get experience in aesthetics. And so this business component honestly has dramatically changed over the last 3 years. And so ultimately Dr. Buford's idea was like, let's do something bigger. And I think a lot of aesthetic providers copy and paste what they see, especially on social media. Oh, so-and-so runs an aesthetic business. They do skincare, they do IPL. I'm going to copy that. I'm going to copy and paste that. But what you're getting is this much of it. Yeah. Right. And you're not looking at the bottom line, the rent, the insurance, the medical director, the, payroll, HR, office management. And so it was, let's bring that into an event. But there are a couple of companies doing events like this. And so how can we take it to the next level? So what we did is we brought in really successful business owners who did it different. Because ultimately you can't copy, I shouldn't say you can't. You can copy paste, but you're going to do what everyone else is doing. If you want to be a super successful aesthetic entrepreneur, you have to be out of the box just a little bit, and you have to do it really well. So the event is, hey, we run a medical practice, really Dr. Buford, but there are so many people doing it so well, let's get them all in one room. And then it sort of exploded from there. So not only is it injectors who have done it really well, it's business owners who have done it really well. And then we brought in the ancillary people. So legal, accounting, software, marketing, consulting, like any of those ancillary people that may make your business dramatically more successful into one 3-day event. So the idea here is to take the business of aesthetics and really make it, how do we get to entrepreneurship? How do we think bigger? How do we think more creatively and out of the box to do this better than all the copy pasting that's currently being doing?
Got it. Thank you for sharing that. Now, I'm sure you have some fantastic success stories from your training program. Do you have one in particular that you can share with us?
Totally. So this injector's name is Hannah, and this is a little bit unique. So Hannah's a PA. She has 10 years of experience in urgent care, essentially. She's a relatively successful urgent care PA, managing locations kind of thing. She has 3 kids. She's in her 30s, and she's like, all right, I'm so burnt out. I've been working my butt off for a decade. I want to do something different. Hannah is extremely passionate about whatever she puts her mind to. So she came to us and said, I want to get into aesthetics, but I want to do it right. I don't just want to side hustle it, start doing this in my basement like a lot of people do. I want to do this right. So she's gone through most of our training courses. I think almost all of the courses. And the last one she took was the fellowship. And she got the fellowship after applying and, you know, like constantly reminding us that she was there for, I think it was like 18 months. Like, hey, I'm really interested in doing this. Hey, I'm applying again. Hey, I'm applying again. I'm really interested in doing this. And then I run the fellowship program, and I've never had, so the fellowship program consists of like 20-ish textbooks and about 180 publications and a lot of really hard homework assignments. And I've never had a student do everything, read everything, like check every single box in this fellowship. The truth is, it's an excessive amount of work, and it's just as much as you want to put into it. So Hannah put everything into it. And then we've never hired out of the fellowship. It's always been like, hey, we're training, welcome to the industry. Hannah was so impressive. The fellows get to bring in patients and treat patients. She filled every single patient spot. She got extremely positive reviews. She did more, I'll say, advanced work than I would expect from a fellow, advanced critical thinking. And so the practice offered her a job. It was like, hey, you're exceptional. Let's bring you into the practice. And now she's building this beautiful aesthetic practice within the Beauty by Buford practice. And that's what we originally envisioned. If she was me 10 years ago, that's what I would have wanted. So she's an ultimate success story. She's doing incredibly well. She's so happy with her life change and, you know, is just so passionate about it.
Got it. That's a fantastic story. Now, I'm sure this is just one of many stories, but what do you see, I guess, what's your vision for the future of your training institute?
Yeah. So accessibility, I think, is the key problem with education and aesthetics. A lot of education in aesthetics has to be hands-on. You can watch a lot of videos, right? But a lot of it still has to be hands-on. So I think there's an element that has to be more virtual with this in-person element. And so growing nationally to partner with other really thoughtful, well-trained injectors to offer these hands-on moments, but really profound or really dense virtual content. And then I think this side of aesthetic entrepreneurship, or how to be successful outside of just the clinical part, is really key. And I think those two things together is what we want to grow. And it's already happening, but I think what we're going to see is this beautiful pairing of dense, self-study like content, kind of like the fellowship, to here's a hands-on moment. Let's do a really dense, full evaluation and treatment plan for a patient, really help develop that creative, critical thinking. And then let's take that into business. Like how do we practically go from, I read the textbook, to this is what I do for a living, and sort of hand-holding that process. That's the future. It's supposed to be a really well-rounded training of how to actually get into aesthetics, not just this is a pattern to inject Botox.
Yeah. Well, it sounds like it's a bright future ahead.
We hope so.
Yeah.
So far it is.
Yeah. Okay. Well, I have one last question for you, but before I ask it, I want to point people to your website at www.coreaestheticstraining.com. Now, the last question is, what is the most important piece of advice you can give to a provider, medical practitioner who knows that they need some type of ongoing training, but isn't sure which program to choose or to go through?
Yeah. That's a great question. And I think that there are only more and more and more fish in the sea right now. And so I would say credibility of your trainers. Look for people that, do this for a living. Look for people that have a decent amount of experience, because that's ultimately what you're trying to gain from them, their experience. And so somebody with a year of experience who does this as a side hustle, you're just not getting the same quality. Not that it's bad, it's just not the same value. And then second, you really have to invest in yourself. I think that I don't even want to share the amount of courses I've taken. I got a whole degree. Really investing, being willing to invest in yourself, but not so far that it seems excessive, right? I think these $25,000 training programs aren't necessary. I think there has to be some reasonable nature to it, right? If we could semi-guarantee you that 3 patients or 4 patients in your clinic would pay for the course, you would say absolutely no problem, right? So look at the value that you're getting for the price. There's so many really high priced options out there. Does the value match? Does the experience you're gaining match? Is it didactic and hands-on? Because is it just virtual content? You can only learn so much from a video. You have to see, feel, hold the syringe, touch the patient. And so I think those are 3 really important qualities: experience, the value, and then what is within that, what components are included in that training.
Yeah, got it. Well, there you have it, Lauren sharing her expertise. Now, Lauren, where can people contact you and your training company?
Sure. So me personally, I have a website. It's theskinscholar.com. That's just the website that goes with my social media handle @theskinscholar. The training company is coreaestheticstraining.com and/or Core Aesthetics Training on Instagram, LinkedIn, Facebook, YouTube, all of it. It's all Core Aesthetics Training Institute. And we would love to chat.
Okay, great. Well, thanks for being on the show and sharing your message.
Thanks so much for having me. It's been such a pleasure.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.